Okay, so we're going to have an interesting discussion. Hopefully, it's going to be interesting about ivermectin. Ivermectin is becoming incredibly popular, even among the truther movement, the natural health movement. There's suddenly a whole big armies of natural health people pushing a big pharma drug and claiming it cures just about everything and there's no side effects. Now, I personally know people who've used ivermectin and had side effects, and one of them happens to be sat right next to me virtually right now, who didn't have a great time with ivermectin. I don't think we need to go into that too much, Stacey, but other than to say it wasn't great for you, right? Um,
No.
so but there are people claiming it's cured about just about everything, and there's lots of people claiming there's no side effects. So we figured it might be nice to have a look at actually the drug company's own claims about their product. So Merck have produced something which sheds a lot of interesting light. We're just going to thought, let's go through this together and have a little look and see what Merck have got to say about ivermectin. And I want you to remember as we're going through this, it's talking about 3 milligram. Now, many people are taking much higher dosages. I've seen a guy on TikTok, I think it was, or whatever, and he was taking the paste and he was just squeezing it into his mouth like this. And then he said, "Oh, here's another brand. This tastes a bit different." It's just kind of crazy. But anyway, three
The
milligram
crazy times. Yes.
is what this particular paper from Merck, I think it says Merck, here we go, Merck, from Merck, this is what they're saying about their own drug. All right,
This
it's
is an internal filing. The latest update was in 2023 as well, just so that people see that. This is the most current one they have on file.
all right. That's pretty recent, 2023, not that long ago.
Hmm.
And that's the brand name or the no, that's the brand name. Oh, anyway, so
Right. Ivermectin is
ivermectin.
the public name. Stromectol is the actual drug compound name.
All right. So there's only 19 pages. It's not going to take us long to go through 19 pages of scientific information. Um, so I like that. Look at that. 7 warnings and precautions. So there are warnings. Um, so let's just dive through. I'm going to skip through all of that because it's just telling us what's coming.
Mhm.
Safety and effectiveness of it. Patients weighing less than that has been established, but see warnings and okay, let's keep going down. Contraindications. Oh, let's find contraindications. So it's contraindicated in patients who are hypersensitive to this drug. What drug?
Stromectol, which is that's silly. That's just silly verbiage. Like, oh, if you're allergic to it, you're allergic to it. They do that on a lot of
Oh,
medications.
that kind of makes no sense, including
It
anyone who
doesn't. How do you know
ingredient.
you're allergic to it till you take it? It's just
Okay, so we're gonna have to get down a little bit before it gets really starts getting into it. I
yeah,
think.
this is all dealing with dosage, which is again, is the 3 milligrams is what this is based off of, is that tiny dose, which is not what people are taking, which is why it concerns me so much.
Okay, because overdosage is a thing. Look, it's a thing.
Yes.
It's important to adhere to recommended dosages. So they're saying now we got to be careful about overdoses. Cases of depressed level of consciousness and coma have been reported with overdosage of ivermectin. Ooh, have you heard them saying that? These tutors that are saying there's no side effects. Not a small side effect. Coma
No.
is pretty serious, right? If in accidental intoxication with or significant exposure to unknown quantities in humans. Oh, hold on, there's a few more things here. Rash, contact dermatitis, edema, headaches, dizziness, anesthesia, nausea, vomiting, and diarrhea. Oh, lovely. Other adverse effects have been
Hmm.
reported include, oh, listen to this one, seizure,
Hmm.
ataxia, dyspnea, abdominal pain, paresthesia, and how do I even say that one? I don't even know
Urticaria.
what that is, Stacey, by any chance. Not sure. Sounds
Yeah,
unpleasant.
urticaria. Yeah.
Yeah, not really sure. In cases of accidental poisoning, so they're admitting that you can poison yourself with this by an overdose. Supportive therapy is indicated, should include fluids and electrolytes, respiratory support. Oh dear. Um, Yeah, none of that's looking good. So I think already from Merck's own information, we can see that the people claiming there are no side effects really don't know what they're talking about, because the drug companies play down side effects. They don't play them up. So if they're saying it can do this, this, and this that are bad, you can be sure it does those things. Because like I say, they play
Right.
these things down.
Well, and people might say, well, then why didn't they want us to have it during, C? Well, that's because it was a cheap drug. This drug is like $4. It's not on the expensive list.
It
It's not
is
a popular
still
drug.
making them billions of dollars a year. I
Yes.
think in America
Yes.
right now, in the US, it's 1.3 billion in the US alone, right? So it's
Hmm.
still a very profitable drug, but nowhere near as profitable as some of the other drugs. Let's have a look at this. Oh no. In these patients, the following adverse experiences have also been reported. Okay, here we go. Pain, including neck, back pain, red eye, conjunctival hemorrhage, dyspnea,
Hmm.
urinary and or fecal incontinence, lovely.
Yeah.
Difficulty in standing, walking, mental status changes, confusion, lethargy, stupor, seizures, or coma.
Coma
Oh
is what
my
blows
life.
my
This
mind.
syndrome has been very
Coma.
rarely following the use of ivermectin in individuals who warrant treatment. Blah, 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 blah. For any reason, and who had significant exposure to lower endemic areas of West or Central Africa, pre-treatment assessment. Blah, 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 blah. Okay. So here's some more stuff. Neurological toxicity, including depressed levels of consciousness and coma, have also been reported in patients with the use of ivermectin in the absence of lower infection. Oh dear, so they
Oh,
get it with
okay.
lower infection and without lower infection. In
And
other words,
without.
lower infection is rather by the by. You just can get that from ivermectin. These events have generally resolved with supportive care and discontinuation of ivermectin. Hmm.
Hmm.
Um,
Hmm. That's comforting.
it's looking a little bit more dodgy than one might think if you just watch the truthers pages. Um, stroma, Stromectol has no activity against these parasites. So it's not all parasites. Even they're claiming that this parasite um,
Right.
is not harmed by ivermectin. Adult parasites resolve cytocollectin of these nodules may be considered. So I tell you now you need surgery, not ivermectin. All right. Historical data show we're just popping through. Okay, what about using in immunized, immunocompromised people like HIV? What's it saying about them? Patients should be reminded of the need for repeated stool examinations. So safety in pregnant women, not established. So they haven't figured that one out. So in other words, not a good idea to take.
Right. Well, they don't test anything
Frequencies
actually
of
officially on pregnant
congenital
women usually.
anomalies, spontaneous abortions, fetal death, stillbirths, infant mortalities in approximately 400 women inadvertently treated with ivermectin during the first trimester in a mass treatment campaign were similar to frequencies in the women not treated. Okay, so they're saying there that they don't think that it did anything, but they don't really know. Ivermectin
They
causes
don't.
Ivermectin caused cleft palates in mice and rats at all doses of 0.4.
Oh gosh. Yeah, it just keeps getting better, doesn't it?
Oh wow!
It's
Oh, not
wild.
just cleft palates, but also club feet at 3 milligrams per kilogram.
Wow.
Um,
That's
these, these developmental
safe.
effects found only at or near doses that were okay. Treatment
Hmm.
women ivermectin should be limited to okay. Breastfeeding. Less than 2% of infant dose of ivermectin appeared in breast milk. Oh, so it does get into the breast milk. Not
Yep.
much, but it does get into the breast
Not
milk.
much, but it does.
So safety in newborn infants has not been established. Therefore, the drug should not be given to nursing mothers. So I'm not hearing this stuff from the truther movement who are pushing ivermectin. I'm just not hearing any of this. Don't take it
No,
this.
I don't hear anything except for just glowing reviews. Oh, it cured this, it cured that. Oh, I take it every single day for a prophylactic. I take this huge dose every Sunday so I don't get COVID. That's what I hear about it. I don't hear about any of this stuff, which is why I took a deep dive on it when I had the experience I did with it because I was like, what is really in this stuff? It's not a miracle drug like they're claiming if my body is reacting this way.
Yeah, I don't understand why the skepticism of big pharma drugs has been completely dropped for this particular drug. And I'm not saying
Right.
that there's no
It's
uses for it, that it might not be beneficial in some situations, but
right. And it's short term
and
type of thing.
short
But
term.
it's never, yeah, it's never been intended to be taken long term. And that's what concerns me is these people, I know people that have messaged me in defense of it, saying they've been on it for years now. And I'm like,
Look at
oh
this.
boy.
It says in 4 clinical studies involving a total of 109 patients given either 1 or 2 doses of 170 to 200 mcg
That's a high dose. Now that's a high dose.
of ivermectin, the following adverse reactions were reported as possibly, probably, or definitely related to ivermectin. Okay, so body as a whole, 0.9.
Asthenia, fatigue, abdominal pain. Yep.
Yeah. It's all, so I don't know what the zero point 0.9 in every situation. Oh, the first four are all 0.9. That was puzzling me, but it has changed now. Okay, so
Yeah.
gastrointestinal anorexia, constipation, diarrhea, nausea, vomiting, nervous system, psychotic dizziness, somnolence,
Somnolence, vertigo.
somnolence, somnolence, vertigo, tremors, skin issues, various skin issues. In comparative trials, patients with experienced more abdominal distension and chest discomfort than patients treated with a different drug. So they're not doing really a placebo here. They're just comparing one group on one drug with another group with another drug. They often do that to make things look better than they are. Right.
Yeah, and the rest that's going into like people that had different conditions that tried it. So that's some sort of I can't say that word. Um, like an eye problem. It worsened that and people with eye issues. But if you keep going down, you're gonna find the
So this
adverse
is the first
events.
time I'm seeing this, just so everybody knows I'm
Yeah,
being trusted. Like
I'm
I've
pretty
never
familiar with
seen
it.
this before. I'm looking at it
Right.
as I'm
Ethan
going.
hasn't seen it. I have.
Uh,
Um, hematologic chemistry is talking about like the blood, all that stuff. All indications hypotension. Yeah, but you're going to come across the part called adverse reactions, which is pretty interesting because, it's one of those things that's being touted as safe and effective across the board, just
interactions
take
with
handfuls
herbal
of it. It's
products
fine.
has not been
Huh?
established. Interactions with laboratory tests have not been established. So there's basically quite a lot of information they don't have. Um,
They don't.
Mechanism
Mm-mm.
of action. Let's get down. Special population conditions.
Mm-hmm.
It's not been studied in patients with impaired liver or kidney function.
Mm-hmm. Mm-hmm.
Definitely not a good idea to take if you have liver or kidney issues. Um,
No, and you'll see that coming up.
we're coming to the last few pages.
Some of this is beyond my knowledge. I'm like, okay, this is a bunch of technical stuff I don't understand about the chemical makeup of it and whatnot.
Another thing that maybe we should mention is that ivermectin has been shown to kill certain bacteria. And if it kills bacteria and it's not targeted, it can kill good or bad bacteria. Oh, look,
It has not been studied for carcinogenicity. I can't say that word either. Carcinogenicity. I can't say it.
although there's people claiming it's reversing cancer, of course, but
Right, but it hasn't been studied for I mean, yeah, chemicals are just not supposed to be in here.
um,
There's also some more information that we kind of scrolled past, but if anybody wants to read this document, just get a hold of us. We can email it to you. It's very, you got to read the whole thing.
here's
You got to really read it in
there's quite
depth.
a lot of people on warfarin, and it's saying it might
Mm-hmm.
interact with it. Right.
Mm-hmm. Now there's side effects right there.
Increase of
And it,
reflex
it lists
time,
it as
that's not good.
you'll see, it's crazy, but yeah.
Low blood pressure, worsening of asthma, Decreased alertness, including coma. I'm pretty sure you're
Yeah.
not very alert when you're in a coma. That's the typical of their language. Oh, decrease of
Yeah,
alertness.
it
He's in a
mentions
coma.
coma.
Yeah, yeah,
Yeah,
not very alert.
mentions coma a lot. A lot of coma mentioning in this document for sure.
Okay, so some people may have feeling unusually weak, loss of appetite, stomach pain, constipation, diarrhea, dizziness, shaking, and tremors. Um, abnormal brain function. Oh,
Mm-hmm.
neck and back pain, bleeding in the
Mm-hmm.
whites of your eyes, oh, loss of
Yeah.
control of your bladder or your bowels, difficulty standing or walking, mental status changes, not responding to other people, or going into a coma. Oh, the coma keeps popping
Keeps
up.
coming back to the coma. That's just,
Um,
it's fine. Can you imagine all this crammed into one of their commercials that they make?
yeah.
Ivermectin,
That
possible
worm that
coma.
causes liver blindness, that's one of the things that they take it for. Okay, so you could end up with joint or muscle pain, swelling of lymph nodes, swelling especially of the face, hands, ankles, or feet, fast heart rate, changes to your vision. And that's not going to be changes where you see better. That's going to be worse, like bad, like
Right.
blindness. Um, bleeding in the whites of your eyes,
That sounds great. Sign me up.
um, serious side effects of what to do about them. So sudden fever, skin reactions such as rashes and itching, or other serious things, difficulty breathing, flu-like symptoms, peeling skin. When they say rare, we know what that means, like nothing.
Yeah, exactly. Yeah, I was one of the rare people.
Yeah. Yellowing of the skin, stomach pain, nausea, vomiting. Um, they've got somewhere you can report the drug, the effects, and they can then ignore them.
Yep.
Okay, so I
Yes.
mean we've flown through that like real quick.
Well, there's adverse events. I don't even think you got to that, but or maybe we scrolled past it. But yeah, there's a whole other section on there called adverse events. That's even worse. Even worse.
Let's try something. So I want to find out. I'm going to ask AI. Does can I spell does? No. Does ivermectin kill bacteria? Now, sometimes AI will. Oh, I can't even spell bacteria. What the heck's wrong with me? Bacteria. Sometimes they will lie to you and try and hide stuff that. But let's.
Hmm.
Okay, well that's just not true. They're lying to me now. So let's see. Let's see if we can. How can we reword that to get them to tell the truth? Okay, let me just tell it to find
Um,
out.
yeah.
So they're lying. They're trying to protect it. Oh, what is wrong with my? Apparently, I can't do two things at once.
Does ivermectin kill bacteria? Yeah, yeah.
If I tell it I know, sometimes it'll admit it. I can't. I haven't got any studies on hand. There we go. Look at that. You were
There we
correct.
go. You're correct.
So this is the bias that they have trying to hide stuff. So you're
Hmm.
correct. I need to revise my previous response. Yeah, I've just caught your line.
Hmm.
While ivermectin is primarily known and used as an antiparasitic drug, research has shown it has some antibacterial properties. Several studies have demonstrated that ivermectin can be effective against certain bacteria, particularly blah blah. Um, However, it's important to note that ivermectin is not approved as a recommended antibacterial. Yeah, we know that. So, okay, so let's ask this question then. This would mean potentially bacteria. Okay, so this would mean potentially that good bacteria would be killed. Yes, that's correct. Okay,
Hmm.
so which may lead to digestive issues, increased risk of yeast infections, weakened immune response, changes in nutrient absorption. That okay. So let me stop sharing there because okay. So ivermectin then, apart from all of the stuff we just saw, which included coma and death, apart from that,
Hmm.
we've just seen that any AI tried to hide because it's the bias is to protect it from big pharma, tried to hide it, but when I knew stuff it didn't know that I knew, it's admitted that it can kill good and bad bacteria. And if it kills good bacteria, that is going to have a negative effect on your microbiome. Now, maybe short term, not a big deal, potentially. However, if a lot of people are taking this all the time, every day for years, they're going to be
Hmm.
damaging definitely their microbiome. They're going to be damaging good bacteria that may never recover. So the question is, should we be taking a product that, according to the manufacturers, has a huge range of negative side effects when there are natural alternatives that don't have all these side effects?
Right.
Okay, I would
Yeah.
say that would be crazy. Why would you do that? Okay, so if
Hmm.
there's anybody that wants to know, well, what are the natural products that we could take, for example, as an anti-parasitic, there's a very, I'm not going to go into it on this call, but both me and Stacey can connect you. Oh, my typing, my fingers weren't working. Now my vocal cords are not working.
No.
So that we can connect you to literally like $39-ish for some of the best natural organic products all put together you can take, and will help naturally, much more gently and safely deal with those unwelcome guests that you might have living inside of your body. That's the way to do it naturally. There's no need
Yep.
to be going to a pharmaceutical drug. It's just crazy to me that so
Yes.
many people that are in the natural world are all getting into ivermectin, fenbendazole, and other drugs. Like, I don't really get it. I don't. And
Yeah, I
most,
don't. Ever since I actually took the time to read the side effects, because that's what happened to me. I got injured by two of the pokey things, and I didn't read any of the data or information. I just trusted the doctors, right? Trusted, oh, well, so and so said it worked. And had I been prescribed ivermectin by a doctor, I would have just been like, oh, it works. Well, the problem with the ivermectin is that it's the word of mouth from the people saying, oh, they don't want us to have it. It was like this whole thing. So now everybody just trusts it blindly, never has read that insert. I was one of
and
those people.
now it's worse because if the doctors prescribed it, there would be a
Hmm.
certain level of some, like, this is the dose and you only take it short term and all that. But because they've pushed it over to the people, they're
Yep.
giving horrific advice. Like, any dose doesn't matter.
Yes.
There are no side effects. Take it as long as you want. All this craziness. The doctors' hands are
Yep.
clean. They're not saying it. It's just regular
Yep.
people who've set themselves up as experts. Um,
Yeah. And they're
and it
poisoning
and it's
themselves.
kind of crazy. And we've got to
Hmm.
say something about this. And like I say, listen, we've all heard the good results from that, and maybe that was to do with ivermectin. Maybe it is doing these things, and it might be a great thing to take short term in certain situations. I'm not even discussing that. I'm just want people to know
No.
that it's not totally safe with no side effects as is being put out, especially when you're doing higher dosage or longer term use. So you just need to
Yeah.
have a little wisdom and maybe not jump onto every passing boat, um, as people seem to be doing. So have a little bit of wisdom. And for those of you that want to do a parasite cleanse, and we have a protocol that we talk about a lot called the results-driven protocol, which changes the environment in the body, which gently changes the situation with parasites anyway. Parasite, it makes it
Hmm.
inhospitable. Parasites, a much more gentle way to go. But if you want to kill some parasites, then
Right.
and you want the very best natural things, like, I'm not going to go into them on here, but you want, all of them in one thing that you can take easily, not expensive, organic, natural, and safe, then we can hook you up with that stuff if you really want to do that. But just be a little bit, look, just ask questions. There are some people that will
Right.
hear this tape and they'll be going mad at what we're saying. It's done this and
Yes.
it's done that. Then you cult mentality, cult mentality.
Yep.
You've got to be able to
Yep.
question. You have to be able to question.
Hmm.
And I'm not here, and Stacey's not here saying do not take ivermectin under any circumstances. You'd never take it. It's a terrible. We're not saying that. We're just saying it might not be quite as good and quite as safe as you've been led to believe. Just stop and breathe and ask some questions, and maybe don't take it long term. Maybe don't take stupid high doses or even unknown doses, just squirting it into your mouth or throwing the tablets in. Just use a little bit of common sense. That's what we're saying. Now, if you found this information useful, If you found it interesting, if it's the first time you've looked at the actual manufacturer's claims on side effects, if you've not seen that and you found, oh, that's really interesting, please share this, let other people know. And,
Yep.
all we're trying to do is get people to think. That's it. Have you got anything
Yep.
to add, Stacey, before we end?
No, I mean, people watching this back might see my face. I'm like talking, I had to mute. My animal was loose and acting crazy. So if you're wondering what was happening, I'm like trying to talk to Sam with big eyes and you're talking and you didn't even notice. But that's what that was about. And just as an overall, the reason that we do what we do is so people know the truth about their health and the truth about what they're putting in their bodies because I wasn't afforded that luxury and almost lost my life. So this is super close to my heart. I just want people to know the true danger, the true potential side effects, because I wasn't aware of those when I did what I did, and it almost killed me.
Yeah, at least have informed choice. That's it. If you want to use the
Yep.
ivermectin after you've seen the comas and the diarrheas and the bleeding out of your eyes and all of that, and you think, no, that's no problem, that's fine. You can take it, but
Right.
at least know about those things.
Right.
Over and out.
A
Goodbye,
heads up.
everyone.
Bye.